afternoon. Jefferson Parish leaders are planning to give an update to the public about their coronavirus response plans and what's been done so far. President Cynthia Sheng is speaking, so let's join in.
So mathematically, our rates are even more troubling than Louisiana, but we're the reason Louisiana is so high is those of us that are in this Orleans, Jefferson Parish area and surrounding parishes. So please understand, I know you're getting it from a lot of places, but make no mistake, we lead the country on this, as we say. Our council members just got finished an incredible conference call with our people of faith and our leaders of faith to get them accurate information, to ask them for prayers, and to ask them to communicate to their congregation the importance of social distancing and staying at home. And it was an incredible call. We had almost 100 people on that call. Jefferson Parish will host a virtual day of prayer. We would like everybody to tune in on our Facebook Live page at 3 p.m. this Sunday, and we're planning that now for Jefferson Parish and any resident to join us in a day of prayer, as we know so many people in our community need these prayers. Our medical personnel at all of our hospitals, at all of our doctors' offices are being tested beyond measure, and certainly we are a community of faith, and we just want to come together in a virtual way in Jefferson Parish to celebrate our lives and the strength that we must have now to get through this crisis. Starting this Sunday, in line with New Orleans, our transit fees will be waived. We are concerned about people passing cash, so our transit fees on our system will be waived starting this Sunday. The governor and the mayor of New Orleans have talked about, and we're talking about, the federal resources that are coming down to the convention center. So that is great news for us in Jefferson Parish as well. This is going to be a regional asset for us. This is going to be a multi-parish asset that patients who are at hospitals that are positive, who are able to, they're not in critical care, but they're able to step down and be a level 2 type of care, that they would be able to go to the convention center and get the medical support they need, but without taking a hospital bed that could be opened up for someone who's in critical care. And again, everything we're doing is about managing our medical resources so that it's not your loved one who's out of a ventilator, it's not your loved one who's told there's not a hospital bed for them. And so please, please, please understand, and I hope we've turned the corner on this, we need to have people understand, if you don't care about it so much for yourself and you think that you're young and you're not going to catch it, think about your parents, think about your grandparents, and think about how we're counting down ventilators. Hospitals are literally counting the ventilators they're being used and how much they can order as we are approaching this next week ahead. The testing continues at the 2 New Orleans area sites as well as our Ilario Center site. You have to be a Louisiana resident over 18 with symptoms to be tested. The lines are long, and unfortunately, we reach our capacity at about 10:30 or 11 every day. So as testing comes on board, and we've seen that through commercial and through our hospitals, that's what we need in this community, but we still stand up our testing site at the Ilario Center. Ochsner, I know, LCMC, they're already going to start looking at in-house testing, and that will be a much quicker turnaround when our hospitals are able to do the in-house testing themselves. Again, I want to point everyone to jplibrary.net for our resources. I've said this many times. We've opened it up to everyone in any parish. You can just jplibrary.net, get on that website, get your temporary library card right on the website, and it's thousands of books, movies, recipes, learn a language, learn a new software. Please, for those of you who are staying at home, check out that site for us. I encourage everyone, this is a two-prong issue we're facing, and this is the two-prong issue of concern. Number one is the medical capacity that we're going to be able to have for our community, and number two, it's the economic suffering that people will have knowing that people are laid off. What keeps me up at night is thinking that families might be hungry. And so please, Second Harvest Food Bank, I visited them yesterday. They have Louisiana National Guard there. They are looking to expand. Please consider a donation to the Second Harvest Food Bank, and that is an incredible way for you to be at home and help in this effort in an incredible way. There has been a crisis hotline for mental health issues. It's called Keep Calm Through COVID hotline. The number is 1-866-310-7977. Again, the number is 1-866-310-7977. That is a Keep Calm Through COVID hotline. And I know everyone's getting tired. I know our medical community is getting weary. And that is why we're doing the day of prayer, the virtual day of prayer, because as we go through this, it's affected my family. We all are starting to know people who are positive. We are all starting to know people who may have died. And it's certainly going to take an emotional toll on all of us. So we're going to pray for strength, and we're going to pray for endurance, and we're going to pray for positivity. And we will get through this, as we always say, a stronger people for it. Today, a big news on the federal financial front, the stimulus package being passed earlier today through the House of Representatives, and we're going to call up later Mr. Jerry Bologna from JEDCO to give us detail about that. I know small businesses are suffering, and that is certainly some big relief coming your way. So we'll be available later for questions, but I did want to invite Dr. Joe Cantor up to speak and give some more detailed news on the medical front. Dr. Cantor?
Thank you. Thank you, Madam President, and good afternoon to everyone. If you're at home and you're watching the national news, you might be tricked into thinking that we're past the brunt of this and it's okay to loosen up on your vigilance. I want to be as clear as I can. That could not be farther from the truth. As President Sheng said, we are just getting into this now. And if there's ever a reason for people to stay at home, remain vigilant, and not let up, that is right now. We're at risk in this community. We are vulnerable for a number of reasons, one of which is we have a lot of comorbidities. That means other medical conditions. Unfortunately, in South Louisiana, we have a lot of diabetes, a lot of heart disease, a lot of liver disease, and a lot of renal disease. That puts us at risk, and that means that when we get sick with anything, we tend to have worse outcomes. COVID is no different. We're seeing high fatality rates at the beginning right now because we have such a high degree of comorbid conditions. What we do with that is important. We need to take that information and recognize that it's even more vital for us to stay vigilant and stay at home. We are more vulnerable here, and so we have to be more vigilant. I'll tell you, the governor and President Sheng have been aggressive in this outbreak, and they've been issuing orders and restrictions well ahead of their counterparts in other areas of the country. Now, that's not to say that it won't go to other places of the country. I think it will. And I think other places are going to soon experience what we are experiencing now. But I don't want folks to watch the news and think it's okay in some other state, so it's okay for me to go back to my normal life. It's not. We're still in the middle of this. In fact, we haven't even hit peak yet. If you look at what's going on in the community, there's a massive undertaking to expand the capacity to provide acute health care at a breakneck pace. Within a week's time, we're going to increase the amount of hospital beds in this region to unprecedented levels. This type of work should be a message to everyone at home that we are in this. It is not safe to let up right now. I want to cover a couple items of advice to people of how to stay safe in this. First is distancing. It's important to remain an appropriate distance from others, and we say that's 6 feet. And that's based on the length of feet a respiratory droplet takes before it falls from the ground, should you be coughed on or breathed on, so forth. So while people definitely need to buy groceries and certain errands that are necessary, when people do that, when people leave their house to do the things that they have to do, essential services, please maintain a distance of 6 feet from everyone else. Also, be really conscientious about touching things. This virus spreads very easily on hard surfaces, so if I'm infected and I touch a door handle or a counter, that virus could stay live on there for hours, maybe even a day or two. So when folks go out and make groceries or pump gas or whatever, be very conscientious about limiting how much you touch hard surfaces and using hand sanitizer or washing your hands thereafter. The other thing I'll mention is testing. In any outbreak like this, we do not expect to be able to diagnose definitively 100% of the cases out there. There will certainly be people that have the disease that we don't get a positive test for, that we don't test at all. At this point, with the amount of community spread we have in this region, the prudent thing to do is for everyone to act as if they have COVID. Everyone needs to act as if they have COVID and stay at home and isolate unless they're sick enough to be in a hospital. And the last thing I'll mention is something that the President has mentioned before, and we've said at a number of press conferences. It's just to acknowledge that our brothers and sisters who work in hospitals now are having a real tough time at it. It's hard work, it's long hours, and they're oftentimes being asked to go without the full compartment of protective gear that we would want them to have. They're honest-to-God heroes, and if there's anything that you can do for healthcare workers that you know, show them some love, I think that would really go a long way right now. Thank you.
Good afternoon. I'm Jerry Satanovich. I'm the coroner. Up until yesterday, we had a total, like the parish president Sheng said, we had a total of 12 cumulative deaths. And then in the last 24 hours, we had another 12. And we now have even a couple more today. Certainly that's tragic, but I want to emphasize that most of the people that have passed away had been sick for a while. Because one thing I don't want the community to think is that all of our efforts are for nothing, that we've been doing all this social isolating and staying away, and look, there's still more people dying. I believe that our efforts are working, but we won't see the effect of that for a while. And so I want to emphasize to everybody, we are on the right track by doing what we're doing with the social isolation. Please don't stop. Please don't think that we've failed as a community because of these deaths that we had in the last day. Expect more. You know, we're not near our peak, okay? And we just don't want our peak to be as high as it could be. We wish it'd be zero, but we know it's not going to be. But we got to work hard as a community to keep doing the things we're supposed to do with social isolation. That's all I have to say. Thank you very much.
Thank you, Dr. Cantor and Dr. Satanovich. I'd like to invite our superintendent of the Jefferson Parish Public Schools, Dr. Cade Brumley.
So on behalf of our school board and our administration, our hearts and thoughts and prayers go out to everyone as we fight this in this community to fight this virus. 3 important updates that I wanted to share with our community today. First has to do with our grab-and-go meals. We will be making a shift with our grab-and-go meals. First of all, it's important to know that we have served around 100,000 meals since we started this curbside just over a week ago. We're averaging around 12,000 meals served per day. Beginning this Monday, there will be a shift. We will move to a Monday, Wednesday, Friday structure, and we'll be serving multiple meals each day. So, for instance, if you come on Wednesday, you would receive a lunch for Wednesday, a breakfast for Thursday, a lunch for Thursday, and a breakfast for Friday. And so this will allow us to be able to provide meals for 7 days a week, because on Friday we would serve meals that would carry through the weekend for our children. So one important shift, beginning next week, our grab-and-go locations will go to Monday, Wednesday, Friday, and be servicing multiple days at a time at our 13 sites. Also beginning Wednesday, we will begin some delivery options where we'll be running bus routes, 5 different routes through the parishes in some of the neighborhoods that we haven't been able to fully service through our grab-and-go locations. Information about those sites will be at jpschools.org/grab-and-go. So the takeaway is we're moving to a Monday, Wednesday, Friday model on our meal service. Next is our at-home learning continuity. As we've said numerous times, the parent is the child's first teacher. Parents like myself are stepping up to the call while our students are home, and we want to thank all of our parents for doing that work and supporting the learning of their children while they're at home. Online resources are at jpschools.org/learn-at-home. We've updated that with the collaboration with the parish to add library resources. We have information for diverse learners, accelerated learners, et cetera, at that website. We do want to announce that this Monday we will be releasing our next round of paper-based learning packets at our grab-and-go sites. So Monday, Wednesday, and Friday of next week, our paper-based packets will be available in grades through 8th grade, but also this time a select number, about a dozen high school courses as well. So we ask that our high school students also show up to those sites. Homework hotline, I want to remind our parents and our students, is 504-349-8999. And then lastly, I just want to speak to our seniors, our 12th graders, our class of 2020. This is supposed to be the most memorable year of your school experience, but not in this way. But let me be clear to our parents and our seniors, you are still the class of 2020. I will work with our State Department of Education, I'll work with our State Board of Education, and I will advocate for you, and I will push for and expect grace for each of you as you remain the class of 2020. Please keep doing your schoolwork. Help me by doing that. These are stressful times for you. These are stressful times for your parents and your families. But as much as possible, do not let this be one of your worries. This has been a senior year like no other, but we will get through it. And know that I am putting you on my back as the class of 2020, and look forward to signing your diplomas. En español, seniors, les ayudaremos a graduarse a tiempo, no se preocupen. God bless.
Thank you, Dr. Brumley. Today was a day for major legislation being passed at the federal level. There are so many different relief measures, and we want to make sure our local business owners understand that. And with that, I'm going to ask Mr. Jerry Bologna from our JEDCO team to come forward and help explain what happened today.
Thank you, Madam President. On behalf of JEDCO, the Jefferson Chamber, the Jefferson Business Council, and all of the business organizations across Jefferson Parish, we are unified in our commitment to businesses and getting them the resources they need at this time. As the President just mentioned, and since we started this press conference, the President has signed the $2.2 trillion stimulus bill. It's been well documented that there's relief for individuals, but there are quite a few measures within that bill that pertain to businesses, and in fact, and in particular, our businesses in Jefferson Parish. So we're doing a couple of things at this time. One, on the JEDCO website, on www.jedco.org, we have placed a resource guide that breaks down this bill. Our staff has been hard at work identifying the provisions in that bill that pertain to our businesses. There are some confusing measures in that bill. Many of our businesses have already begun filing for economic injury disaster loans through the SBA, but this bill does call for 7A loans, which are an SBA product, to become forgivable if businesses use those proceeds to maintain their payroll, pay their rent, and pay their mortgage. I think this is a huge incentive for our businesses that are making decisions every day on whether or not to retain their employees. We implore them to make these decisions with this in mind. In addition, on Monday at 1:30, JEDCO will be hosting a Zoom meeting online, and you can go to jedco.org and get this information, but we will break down the bill and what it means for our businesses in Jefferson Parish. Again, this is for businesses in Jefferson Parish. In addition to the forgivable loans, there are plenty of important items, such as the delay of certain tax filing deadlines, and unemployment insurance benefits that will benefit our business community. So I want to say on behalf of the unified business community, this isn't our first time in the face of disaster. We have plenty of lessons learned in previous situations, and our unified message to you is we want our businesses to be in a position to succeed as soon as this has passed us. We realize this has taken a significant medical impact on our community, but it also has taken a very serious economic, or had a serious economic impact on our community. So we are committed to getting our businesses the resources so that they can succeed. Thank you.
Thanks, Mr. Bologna. We do have some of our council members here. I want to give them an opportunity to address you. They have been on the front line of this COVID-19 virus. They are communicating with their constituents. So we have, I'll start with our at-large member, Councilman Scott Walker. Did you want to come give an address? And then we have followed by our other council members that are present.
Hi, everybody. Not a whole lot to say on this end, except that I can speak for the entire council, are a resource for you, and I'm speaking to the people of Jefferson Parish. Our jobs now, the way I see it, are to put out as much information as we can in as real of time as we possibly can to keep you as up to date as you can be. There is a lot of misinformation out there, as I've talked about before, so it's important to deal in facts right now. It's important to see where your news sources are getting their information from and make sure that you don't help spread any unnecessary fear or panic. So all I would ask is use us as a resource. All of our offices are reachable. All of us are working. You can contact us directly through our Facebook pages, through our emails, through our direct numbers here. Everybody has the phones rolling over to people on their staff if they're not in the office here. So we're all reachable. We're all available. This is just another obstacle for us to overcome together, and we're going to do it. We're doing it already. I think as I drive around, as I just came from my house to here today, seeing the few people on the road that I'm seeing is a good sign. Seeing few people in the groceries is a good sign. So heed the message, continue to self-distance, don't go out unless you have to. Get your groceries, get your prescription drugs, and do what you need to do, but if you don't have to be out, please don't go out. Thank you.
I did want to mention, we've gotten some messages today from people who have gone through our mobile testing site on the West Bank at the Ilario Center asking about results. That mobile testing center was stood up by the federal government. It's being run essentially by the state. So we are aware that there seems to be some delay in the results. So if you are one of those people who's gone through a mobile site and you are waiting on the results, we do know that there seems to be a delay. Our parish president has been very proactive in reaching out to the governor and reaching out to those above our government to alert them to this problem and see if we can get those results coming back to us more quickly. But again, if you're in that number and you're waiting and might think something's wrong with your particular information coming back, we are seeing that across the board right now and are trying to address it.
Thank you. I'm Dominic Impastato, Councilman for District 4 here in Jefferson Parish. I just want to say a couple things. Number one is what we're doing is working. The commitment from the community, as Councilman Walker pointed out, is clear. And all of the experts, all of the medical experts like Dr. Svetanovich and others are saying and seeing that what we're doing is working. While the numbers we get tomorrow, the numbers we get next week may not seem like it, but the results of what we're doing today are going to pay dividends down the line. We're going to get through this. We're going to achieve the result that we want if we stay committed as we are. But the question is then, what do we do then? And my appeal right now is to all of you who own businesses, all of you who operate and manage businesses in Jefferson Parish, in the greater New Orleans area, and frankly in the country as a whole. And I'm one of you. I'm a small business owner myself. If you're thinking about making personnel decisions, payroll decisions, rent decisions, facility decisions, I'm going to beg you, please don't make those decisions until you have thoroughly vetted the stimulus package that was approved today in Congress. Consult your local bank, consult your accounting and tax professionals, consult JEDCO, GNO Inc., the Jefferson Chamber, and those resources. Get a full working knowledge, because I think once you see it, once you learn the things that we've had the opportunity to see, you're going to see there's an opportunity here to keep people working, to keep people getting their paychecks, to keep people in our community paying their bills, and we're going to be able to make it through this and ultimately be bigger and better and stronger than ever. But please consult those and learn everything there is to learn about those before you make any major decisions, before you lay anybody off. If you've laid somebody off, hire them back, because you're going to see an opportunity to keep your business going and thrive through this at the end of the day. The last message I want to leave you with is that your Jefferson Parish government is operational and fully functioning 7 days a week, 24 hours a day, okay? While everyone may not be physically in the building, we are operating, we are providing those services. Where the law allows us to do a video conference or a web conference in lieu of a public appearance, we're doing it to keep your services running so that the citizens in Jefferson Parish do not lose one single bit of service, to make sure that the quality of life they have here is what you expect and what you demand of your tax dollars. If you need us, reach out to us. For me, my cell phone number is on the web. It's on the Jefferson Parish website. I'll give it again, 504-343-7327. Email us, text us, Facebook us, Twitter, Instagram, whatever. Reach out to us. We'll provide you the services you need. Thank you, and wish all of you the best. Thank you, Parish President.
Thank you so much, Councilman. So now we can have an...
All right, you've been listening to a press conference with Jefferson Parish leaders and even some leaders from the Department of Health about COVID-19 and the response in Jefferson Parish. Obviously, some disturbing numbers coming out of Jefferson Parish, just as they have been out of Orleans. It sounds as if Jefferson Parish hospitals are also going to be leaning on that makeshift hospital over at the convention center if they do reach capacity. We also heard from Jefferson Parish leaders that they are planning to host a gathering of faith Sunday at 3 p.m. on their Facebook page, on Facebook Live, so that everyone can join together as a community of faith and not actually physically go to church or to where they would worship, and just kind of have a community-wide gathering of prayer. So some disturbing news out of Jefferson Parish. They are seeming confident and comfortable with the fact that people are staying home, and they are encouraging everyone to do that.